Today's episode is entirely dependent on diabetes, so if you have a client or a friend at home who has diabetes, better tell them to tune in. You're most welcome to the DAKTARI show. I'm your host, Sunday Junior Tom. Hope your morning is fine. Of recent, a study done by the Uganda Cast Spotlight in 2022 found out that over 716,000 people in Uganda live with diabetes, and actually 89% of these people who have this diabetes don't know their status and they are not on medication. Often these people, they lose weight. Actually, in the communities, some people could have lost weight and rumors moved over them that they have HIV, but they go to facilities, health facilities, and they find out that they are HIV negative. Only that on further analysis, it's when the doctors find out that these people are positive for diabetes. With us, we have a doctor, Dr. Drasil Roni Mobutu, who is going to discuss with us what diabetes is, the types of diabetes, clear these myths about diabetes, and also give the self-management or home management while you're home there. When you're living with this diabetes, how can you manage yourself? How can your family support you? And also the nutrition aspect part of it. Which foods are you supposed to eat and which foods are you not supposed to eat? You're most welcome to the DAKTARI show, Dr. Drasil Roni Mobutu.
Thank you. Your name, sorry?
Sunday.
Sunday. Yes. Sunday, thank you so much for welcoming me for this DAKTARI show this morning. As I said, my name is Dr. Drasil Roni Mobutu. I work with the AAR Arua Clinic. AAR Arua Clinic is found along Weather Park Lane, plot 82, as we head from Arua Hill roundabout, heading towards Varadi. That's where you find AAR. It operates from 8 a.m. to 8 p.m. and offering general consultations, pharmacy, and lab, and also imaging like ultrasound. I'm privileged to be hosted by Western TV to talk about diabetes. Diabetes, as you said, is a condition that is beginning to appear so common in our healthcare practice, and so it is important that we get information, because one of the cares of diabetes is actually to know what diabetes is. As you said, many people are living at home, as the report said, without getting treatment for this diabetes. So, what is diabetes? Diabetes is actually a disorder where the body fails to absorb the sugar that is taken in. You know, we need sugar. Sugar is like fuel that drives. It's like fuel that drives cars, and so it's fuel that drives the body to do different activities. And so if the body fails to take up the sugar piles up, builds up in the body, especially in the blood, without getting into the cells. We have various cells, of course, the cells in the muscles and the adipose tissue. And so these cells need sugar to get in so that they can do their works. And so in the event that the sugar doesn't get in, therefore the body does not work normally. Yeah. So as I said, when the body fails to absorb this sugar, then that means there's a disorder that the body has. And therefore, when you come to such a person who has disorder of failing to absorb sugar, then will present with certain symptoms. One of the first symptoms will be having an excessive thirst, the urge to drink a lot, but also will have an excessive urge to urinate more frequently, especially at night. This person can wake up several times to urinate at night, and most often will be weak, even though he's eating, but he's weak because why? Sugar isn't getting into the muscles. And so if sugar is not getting into the muscles, then he has no energy to do whatever he wanted to do. So most times he's feeling weakly. And of course the other is he will begin to lose weight. Why is he losing weight? Because sugar had to go into the blood, into the muscles, and then into the adipose tissue. In the adipose tissue is when the sugar would be deposited there in the stores and keep the size or weight of the person. And so in the event that sugar is not getting into the tissues, the muscles or the adipose tissues, the body will develop a mechanism of trying to find some source of energy in order to do its work. And so we begin to break down its stores. And that's why we lose weight, because sugars are stored in form of fats, and if we do not have the sugar, we'll go for plan B. The plan B is to break down the stores. And if the fats are broken down and still there's no sugar, it will go further and begin to break down the protein. And so that's how one will begin to lose weight. So when you see suddenly somebody has turned to become very thirsty, unusually thirsty, and excessively thirsty, and has become is urinating more often and is losing weight, then you begin to think this person could be having diabetes. And so there are types of diabetes. We initially said this is a disease or a condition where there is a disorder where the body is unable to take in sugar.
Okay, maybe to interject a bit, doctor.
Yes.
You have given the medical part of it, of what diabetes is and how often it comes about. In our societies, there are some myths about this diabetes, that maybe it is as a result of witchcraft. Some people, that's what they believe. Some believe maybe in their younger ages they took tea having more sugar. Yes. And also some have other cultural beliefs about this diabetes. How true is it about these two myths, about taking too much sugar and also maybe relating it to witchcraft?
Okay, thank you so much. I think, moderator, you've put it very clearly. Maybe this is one thing that Adam said, that the body fails to take up the sugar that is there. You know, when we eat food, this food is broken down. And once it is broken down, most often it is either broken down, especially in line with diabetes, is the food that we eat, like anything that we eat with the sauce, we perceive that this is going to generate sugar. And so, if it's broken down into sugars, in order to be absorbed into the body, into the muscles and adipose tissues, for its work and or storage, there is need to have a key to open that door of that store for the sugar to get in. And that is what medical we term as insulin.
Yes.
Insulin is produced in the pancreas, an organ called pancreas, the beta cells of the pancreas. And so if the insulin is produced and the body is unable to respond to this insulin, that will lead to diabetes. Okay? So it's clear what diabetes is. And if the beta cells are destroyed, it's no longer producing insulin, then that means that the body lacks insulin. So therefore, if the body is able to produce insulin, but the cells in the muscles, in the adipose are not responding to this, it's like you've used the wrong key to open a door, and therefore sugar will not be taken in. And if it's not taken in, and that is another cause of what? Diabetes.
Yes.
So it's not what you eat, basically, primarily, but it is a disorder in as to what you eat that is failing to enter where it's supposed to be, either into the muscles or into the adipose tissues. Those are fats where it's supposed to be either utilized by the muscles for its activities or stored in the adipose tissues to be kept there for some time, or even utilized because there are also cells that are living, and so they need energy. And so, is it taking excess sugar? Yeah, maybe partly if you overwhelm the system. So the rate at which it is taken might be affected. Usually this comes with aging. You know, with aging, like anything that becomes old will not function efficiently as it used to be.
2 years out.
Yeah. So usually this happens commonly when people are above age of 30, 35. And the commonest diabetes around that time is actually called the type 2 diabetes. Okay? Yeah. But the other is the type 1 diabetes, where the body fights itself. A condition where the body fights itself is called an autoimmune condition. So the body fights itself. In so doing, it might destroy the cells that produce this insulin. And therefore, the insulin is destroyed. The cells that produce the insulin is destroyed, and therefore insulin is not made. If insulin is not made, then the body fails to take in the sugar that we eat from whatever source of food that eventually is broken down into sugars. And so that means that, yes, whereas the body's muscles are sensitive to take up this, to insulin, but the insulin is not produced. And so that is classified as type 1 diabetes. It's an autoimmune condition. The body fighting itself, including destroying the cells that produce the insulin. Those are the beta cells of the pancreas. And so basically, it's not about probably what you eat. What you eat comes later on, probably, because of aging, inefficiency of the cells to work. But witchcraft, certainly not. It's not because of witchcraft at all. I think I've put it clear that the body, once you have sugar in your blood, that sugar needs to go into the muscles or adipose tissues, either for utilization or storage. And so if that is not done, then certainly it will what? You will not be able to take in the sugar into the muscles or into the adipose tissue. So there will be excess sugar beyond the normal limit that is expected to be in the blood. And so therefore you begin to feel those symptoms I told you: excessive thirst, over urination, you begin to lose weight. Yeah. So those are some of the things that you go through.
Actually, also maybe to bring in another means, the community believes that diabetes is a disease for the elderly, that young children can't get this diabetes. How true is it?
That isn't true. That isn't true. I think I've already said that type 1 diabetes is majorly, earlier on it was known as disease of the young, because those autoimmune conditions are believed to be an inheritance from your family tree. If my father or grandfather had a challenge with the body fighting itself, and including destroying the beta cells of the pancreas that produce the insulin, then there are chances that can develop. So those are some of the challenges. So diabetes, we see diabetes in kids, we see diabetes in the young people. By the way, we see diabetes also in pregnant women, because there's hormonal imbalance that may trigger diabetes in a pregnant lady. But this is transient. After pregnancy, it may go away. Okay? It may go away. So basically that is it's not disease of the young or the old. It is disease that all of us are at risk of getting. Okay? Because do we know your gene line, whether you have an autoimmune condition in relation to autoimmunity against your pancreas, the beta cells? You don't know. We don't know. And so because we don't know, we all subject to what? Yeah, we're all subject. So, but with aging, I said earlier, cells become weaker, and so they either produce little or eventually no insulin. And so if there's no insulin, also sugar cannot run into the muscles or the adipose tissues.
Okay, maybe doctor, also you can add in more light. I heard you talk of diabetes type 1, diabetes type 2. Maybe you can throw in more light to further differentiate these diabetes, and also maybe if they are specific to a given age group. Yes.
I did say in type 1, the main, this is now technical, because out there, maybe if you're not medical, it may not be so interesting for you, but if the body fails to produce insulin, we classify such diabetes as type 1, because the body is unable to make insulin. So why is the body making insulin? I already said there could be an autoimmune condition where the beta cells have been destroyed.
Yes.
Okay, but also then type 2, usually there is now insensitivity. The key unlock, the insulin failing to open up those stores well, so there is insensitivity of the body to insulin. Generally, the muscles fail to open up. Even when there is insulin, they fail to open up, or they need so much insulin in order to open up, so which the body may not produce at such an amount. So basically, the difference is that nitty-gritty. Used to be a thought that maybe type 1 is basically in the young and the type 2 is majorly in the what? In the elderly. But vice versa, it can happen because an autoimmune condition can be triggered by anything. Could be a viral infection, can trigger an autoimmune condition. A bacterial infection can trigger an autoimmune condition. The body begins to fight itself, and if that includes destroying the beta cells of the pancreas that produces the insulin, then you find yourself going into diabetes of what? Type 1.
Okay. All right. Thanks very much, Doctor, for that discussion and giving in more highlights to the dear viewers outside there. Hope our viewers are getting to know diabetes. Even if you're young or old, you are at a risk of getting this diabetes. And also, doctor said there are 2 types: type 1 and type 2. So he said of old, those old days, type 1 was, people could say, is for the young, and type 2 for the old. But he made it clear anyone can get either diabetes type 1 or type 2. Maybe, doctor, again, we pick up from there. What are some of the risk factors or predisposing factors someone could do to put him at a risk of getting this diabetes, or maybe the causes of this diabetes?
Yeah. Thank you so much, moderator. There are certainly so many risk factors. I think, as I was discussing, I already mentioned some.
Yes.
But one of them is actually this autoimmune disorder. If you have an autoimmune disorder where your beta cells of the pancreas are destroyed, you are at risk of getting diabetes. But I also did say that some of the diabetes are in the pregnant women, and so if you're a woman and you're pregnant, so there are chances. One of the risks is actually now that pregnancy. Okay, one of the risks will be that pregnancy, because there will be issues of hormonal imbalance, even if you're not pregnant, by the way, because hormonal imbalances may not only occur in what? In pregnant women, but in the pregnancy we've noted gestational diabetes, and so we think having pregnancy can be a risk factor in this. And then also, of course, inactivity. You're inactive. If the stores are full, you cannot push more sugars there. Where will these sugars remain? In the blood, yes. Isn't it? They remain in the blood. So sedentary life, where you're mostly seated, you're not active, you're not physically active, that means that you're unable to utilize the sugars that are going in, and so you stand a risk. So overweight is another. Those are some of the risks. Overweight is another, could be a risk and a cause. Overweight is a risk, but the main cause, of course, is the body responding to insulin. Is the insulin opening the keys to those stores, and sugar is getting in? And then, are we utilizing these sugars? If we aren't utilizing them, where are they piling? They pile backwards in blood, exactly. And so those are some of the risks that you may be able to have: obesity, overweight. And so how do you become obese or overweight? By overeating. It's as simple as that. And so if you're not dieting well, then you're exposing yourself to what? To diabetes. Yeah? Why we stop attaining or growing at the age of 25. That's attaining a height. So at 25, I'm already fully grown. But you know, you need a lot of energy to grow. Okay? So you, after age of 25, your dieting must shift a bit, where half of your food should become fruits and greens and vegetables. Those ones have low sugars. Once they're broken down, they have low sugars, and therefore little sugar will go into blood. Because then also, at that age on, you do not need a lot of sugars because you've ceased growing, okay? You've ceased growing. So you don't need a lot of sugars to take into the body. So that will help you. That means overeating, eating poorly, especially foods that have lots of sugars, is another risk factor of getting diabetes. Okay? What else? I already talked about exercises. If you're not exercising, then you're exposing yourself to diabetes. Okay? Yeah. And then also infections, we cannot control some of these infections, viral, bacterial, where the body can. Some of these bacteria and the viral genes, they mimic, they resemble our normal genes, so the body thinks it's fighting them when it's actually fighting us, especially if these tissues are the beta cells of the pancreas that produces insulin. So those are some of the risks that you can find yourself into. I already talked about the insulin, the hormonal imbalance, already talked about that.
Also, maybe I had you talk about this family thing.
So if there is anybody in the family, in your immediate family, a mother, a father, a brother, that family tree, if there's somebody who has had diabetes, there are chances. They say a seed normally does not fall far off from the tree. Okay, you don't find a mango fruit and a pawpaw tree. So because it falls near, if there is anybody in the family that already has diabetes, there are chances that the children or the children's children might develop diabetes. Okay? Those chances are there. So it's either genetic exposure, because we get our genes from our parents. They got from their parents, who are our grandparents. Okay? So that kind of line.
All right. Thanks very much, Doctor. Maybe again, you have taken us through the causes of this diabetes. You also talked of some of those signs and symptoms like losing weight, feeling thirst. Maybe you can further emphasize more on those presentations or the symptoms, how someone presents, such that in case they get these signs and symptoms, they can further run back to the facility and get tested, then they can start their treatment. You can again maybe highlight on those cardinal signs and symptoms.
Okay. Thank you so much, Mr. Moderator. As I'd said, one of the signs is if the sugar is not taken in, that means the stores are going to be empty. What makes us gain weight is sugar is going in and being stored, and that storage, the more you store, the more you increase in size. And the more you increase in size, the more you increase in weight. And so you have diabetes, sugar is not going in, so the body, the body begins to deplete the stores for its energy needs, and therefore you begin to lose weight. So you begin to lose weight even when you're eating normally. Okay? And because sugars are not getting into the muscles for you to do activity, you begin to feel weak. You begin to feel weak and tired, easily tired. And the other I'd said is, another one is there's this, I said, excessive thirst. You'll have excessive thirst, the urge to drink often. You want to drink more. Your thirst is never being quenched by the amount of water. This becomes unusual, because normally when you thirst, you drink and you get satisfied. The thirst goes, but this time the thirst is never going. You drink lots of water, but the thirst is not going away. And also you urinate so frequently, especially at night. You can wake up even up to 10 times in the night to urinate. This is unusual, and so there must be an issue with me. And those are key signs. And if you urinate outside, you find many ants come to eat that. They gather onto that, especially the black ants. They gather onto that where you've urinated. You know why? Sugar has attracted them, because you will leak sugars through that urine. Lots of sugar.
So it means these diabetic patients, when they're urinating, their urine contains sugars.
Exactly. Sugars will leak. Because it's excess, so the body finds different ways of trying to get rid of the excess sugars in the blood. One of them is to get them through the urine. Okay? So you can have blurry vision, blurry vision means that you begin to see hazily. Things don't appear so well to you, and so that means that there is something going on with you. And at times, mentally become confused. You may become confused. You may begin to feel some sensation, tingling sensations, as if somebody is tickling you. Yeah? And so, because sugars, excess sugars, begin to sit anywhere. They're deposited anywhere, they're not accessing their store, so they can camp anywhere. That includes on your nerves. So you begin to lose sensations to some of these things that you're sensitive to. You begin to lose some sensation. So either tingling sensations, you have them, or you begin to lose some sensations. Okay? And that's so much that actually down the road, some of the complications are because you get injuries that you don't even feel. Why wouldn't you feel them? Sugars have sat on your nerves, because nerves are the lines that will inform the brain that there's pain here, please withdraw your leg or your hand from this harm. But because you're not feeling anything, because sugars have sat on, you miss that opportunity, and then you develop wounds, and wounds don't easily heal. Why would these wounds easily heal? Because of many reasons. Sugar is sitting on these nerves and are sitting on blood, and so sensations are not going into the brain, so the brain cannot deploy the soldiers to fight diseases, and so even transporting blood into those areas with healing factors becomes a little bit challenging if sugars are sitting there, and so you begin to develop some of these challenges. Okay.
All right. Thank you very much, Doctor. So in case someone gets these symptoms, they are feeling thirst, they are losing weight.
Yes, they're losing weight.
They are also
excessively feeling thirsty. Yes. They are over-urinating, especially at night, and feeling weak, not gaining weight. Yes. Then you think this could be, this person could be suffering from diabetes.
Okay. Yeah. All right. Thank you very much, Doctor. Hope our dear viewers have gotten to note of these key symptoms you could get, or signs, and in case you get them, it's advisable for you. You run out to the nearest hospital, you get tested such that you can start treatment for this diabetes before it progresses. Yeah. Because it has complications, which doctor also will take us through. All right, dear viewers, let's first get into this short commercial break, and we shall be back briefly, where in the next segment, doctor will take us through the self-management aspect part of it at home. When you have this diabetes, what are you supposed to do? How can you live? Then also give us the nutrition guidance part of it. Which foods are you supposed to eat, and which foods are you supposed to forego? Then we should conclude it and wrap it up with the complications which diabetes presents with. Thank you very much. Let's get back.
West Nile TV, lighting up the region.
Brand new Global Star TV with StarTimes Inside Technology. New TV innovation with an inbuilt decoder that connects you to both StarTimes antenna and satellite signal. With StarTimes Inside Global Star TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update, more benefits, more affordable. StarTimes Inside Global Star TV is available Available in all StarTimes branches and dealers countrywide. StarTimes Inside. Entertainment inbuilt.
We are the passion you've been waiting for!
It's Yunus Junior Santamo!
It's our league, our football, our boys, our style. StarTimes UPL new season starts 15th September. Go for it!
What a finish from Ashraf Bukume!
The Ugandan flair, Brazilian samba, Portuguese magic, the night football craze. More TV games live on Senyuka Prime and Fufa TV only on StarTimes.
The StarTimes UPL. Our league, go for it.
West Nile TV, lighting up the region.
We'll be back, our dear viewers, from that short commercial break. Those who have just tuned in, it's the DAKTARI show here on West Nile TV. And Dr. Vries has brought us into a discussion of diabetes. We have been discussing the types of diabetes and also the signs and symptoms and also the factors which can predispose you if you're outside there to get this diabetes. And also Doctor took us into the details on how to do it. So in this next segment, Doctor is going to take us through the self-management aspect part of it. In case you are home, they have tested you, you have this diabetes, how can you live with diabetes? And also, how can you always test yourself with diabetes? Thank you very much. We'll be back from the short commercial break, Doctor.
Okay, thank you.
All right.
Okay,
we can pick on from there. So if someone has gone to the hospital and have tested positive for diabetes, how do you advise these people to live? And also maybe in case they have these RBS machines, how you can show the viewers how to use them, and also you would help us guide on how often, how frequently should someone do it. Is it every week, after a month? And also you're giving further guidance on it. Thank you very much, Doctor.
All right, thank you so much. Indeed, this how if you have diabetes or somebody in the family has diabetes, one of the first things is to know about diabetes. Inform yourself about what diabetes is and get this information from a medical worker, because you may be shocked. People have their own versions. You talked about myth. People have their own beliefs or these things, but come on, professionally, people have been trained for you, others for 5 years, others for 10 years, others for 20 years, just to help you address your condition. So seek information. That's number one. Be knowledgeable about diabetes, and then how you can be able to take yourself, your care of your own self while at home. So once you sort information, then you know that this is, you're dealing with diabetes, your body is unable to take in sugars or utilize the sugars, then one of the things is, we already talked about this, some of these things are because you're overweight or you're overeating foods that have lots of sugar when the body does not need that much. So the excess piles in the blood. So you reduce, you remodel your diet. Okay, you remodel your diet. Remodeling your diet means that which kind of foods then do you need to eat that may not be having so much sugar, so much that if you eat, it's going to pile up in your blood and cause you problems in diabetes. So we would say meat should be eaten less often. You don't need that much. And we said we stop growing at the age of 25 years where growth plays close. So why do you need meat? Meat provides you proteins, excess of it is converted to energy and stored. Okay? And so you don't need that much. You don't need this lots of sugars so much, because the body would utilize it for excess growth. But your face is growing, and so you don't need it. Even then, you're unable to absorb the sugars that are in you. Your body is unable to manage the sugars in the blood well. So the other thing is to do that. Then, if you've had information about diabetes, and then now you've modeled your diet well, then you have got to add exercises on this. Because then that will help you burn out the excess sugar that have sneaked in. Yeah. You know, at times we eat because it is tasty, at times we eat because big occasions have come, and so you blow everything. Yeah. But then you need a routine, you need a discipline to do exercises so that any excess sugars that have gone into your blood can be burned, and so that you maintain your sugar within the normal ranges. And so in places where people have, by this dieting, doing exercises, knowing about diabetes must cut across whether you have diabetes or not. Because, so having information about this disease is important because it's a chronic condition, most likely that you're going to have it for life. And so that's why you must have information so that you're in charge of this condition. Just like you're in charge of your hunger. When you feel hungry, you find something to eat.
Yes.
Exactly. So that's the same thing you do with it. Diabetes, you become in charge of it. When there's going down or up of the sugars, you become in charge because you have the information. And then I already talked about the exercises and then also dieting. Okay, then dieting, what kind of foods do we eat? Does the body still need the foods with sugars? Certainly, yes. We're still active, we do a number of things. Even the mere act of taking in air, we take it as though we don't need energy. But it needs energy. But how much energy is not as much as if you're doing some active activity. And so we still need those sugars. So usually we encourage diabetic patients to eat foods that have sugars in complex form. In complex forms, things like milletage sugar, but in complex form called starch. Okay, so for this starch to become sugar, it has to undergo a series of breakdowns. First of all, you crush it with your teeth. It goes in and in your stomach, and then down it's broken down into many sugars, then simple sugars, and then one sugar, and then it goes into the body and it's taken. So that in that way it moves slowly. But if you took, for instance, the sugar you stir in tea, then suddenly the body realizes sugar levels have shot up. It's a sudden occurrence. We don't want to shock the body system because now our body does not control these sugars well. So we want it to come gradually. That's why we encourage foods with sugars that are in complex forms. These include the millet, the cassava, as eaten one. Most of the foods where you don't taste sweetness in them actually has complex sugars. And so that is good to go. Okay, then a lot of vegetables and fruits and greens. Not necessarily those which taste so sweet, but fruits and greens and vegetables, we call them protective foods. Okay, they give you less energy. Yes, they have some sugars in them that would give you that would make your blood sugars to rise, but they are not so much like they are in foods that are entirely carbohydrates and in forms which are not complex. Okay, so that means that you can't do these things. But the bottom line is do exercises, because any excess energy or glucose that goes in is utilized in the activities that you do. And so in that way it will keep the sugar levels within. And then for people who already diabetic and they're managing, some already have what we call the glucometers. They keep taking their sugar levels either every morning or when they feel uncomfortable or when they're about to have a meal. They take their sugar levels and then they do appropriately. So that means that even though diabetes allows sugars to pile in your blood and therefore move up, but when you're in a medication of diabetes, there are chances that sugars may even go low, much lower than the normal limit, and that causes you also trouble. And when at times you begin to feel your body, the whole body is shaking, and you're sweating, and when you're diabetic and you're taking your medicines, you are on time, and at this point you've not eaten, you're feeling, you're shaking, you're sweating, then it is important that we actually encourage diabetic patients to move with some sweets in their pocket. You can pick one sweet and begin to eat. Okay? But testing for your blood sugar, we usually use something like this, what we call a glucometer. It's a glucometer. And then we have a pricker like this. This is most often sterile. And then you clean where you need to take your sample from. And that sample, this glucometer usually has some stick that they put in. It appears like this. They are very tight, so you'll see something like this, and then this they show you how it is fitted here. There's this small arrow, this whitish arrow. It tells you where you're fitting it, and then where it is being received on this glucometer. And so you slide it in here. The moment it reaches there, it will display a number and show something like a drop or something. It is expecting a drop of blood. And so you pick a finger, especially at the sides. You clean there very well, and then you pick a pricker, you just prick there, and then a drop of blood will come, and then you put it to drop into this other side. Once blood drops in here, this machine, the glucometer, will read the sugar level. And so the normal range of blood sugar could be between 4 to 7.5 millimoles per liter. But also some of these machines are calibrated in milligrams per deciliter. We usually multiply that by 18 in order to get an estimate of that. So about a millimole of 4.4 millimoles per liter, if you multiply that by 18, that would be 98?
Yeah, 98.
Around 98 milligrams per deciliter. So you multiply by 18 if your millimoles, the reverse is true, you divide if it's you want to get in what? In milligrams. But that's okay for what? For scientific people to do. Okay?
Yeah.
So only that you take good care of this after pricking, then you keep it well. At times, because of economy, people still store this to utilize, but can become source of infection for you. Okay? Basically, that is it. So your sugar levels are the normal is between 4 to 7.5. That is a normal. But if it goes beyond that, around 11 millimoles per liter, we begin to think you're pre-diabetic. Yeah. But at 11.1 millimoles per liter and above, we think you're diabetic. Yeah, so on 2 occasions, if you come as a patient, if we pick that on 2 occasions, and then we think you're diabetic. But it could surge up if you ate very sugary thing, it could surge up, but it could normalize, the body can take care of it. It's an instant. We give you another room. Usually we go after a random one. A random one can be picked at any time, but a fasting one means that you should have had your last meal about 8 hours earlier for us to take this one. And so we can take that and see where your sugar levels fall. Is it within the diabetic range or within the normal range? If it's within the diabetic range, then you're given another appointment to repeat that. If it remains, then they can begin to counsel you to begin to take medication for diabetes. Okay? Yeah. So basically that is what we can be able to do, and for those who have the machine can be able to use. If you do not have, please seek information from a healthcare provider. I'm sure you'll be helped. As I said, one of the first cares, especially for you who is diabetic, is to know about diabetes. Know about diabetes. Information is very important. Yeah, so know about diabetes, and then they modulate your diet according to your body's need and your activity, and then we move to exercise. Those are core for everyone. So exercise is for every one of us. If you're above 25 years, we need all to be engaged in exercise. Jogging around, riding a bicycle, swimming, doing aerobics, That's very important for us, at least for 30 minutes.
Okay.
That would be a good exercise, medically good exercise to manage, to balance your sugar levels.
Okay.
Yeah.
All right. Thank you very much, Doctor, for that discussion. Actually, it has been detailed. I hope other viewers, those who have diabetes, you have gotten to know how to manage yourself and maybe your parents in case they have it, on how they can live with this diabetes. And also, Doctor, talk us through the procedure on how you can test your blood sugars using this glucometer. Maybe, Doctor, what you didn't maybe talk about. Suppose there is a patient who has, or someone is at home has this diabetes, and they test maybe today. How often are they recommended to test again? Because they may not necessarily need to come back to the hospital, but how often are they recommended to test for these blood sugars?
Okay.
Yes.
Yeah. Ideally, the best would be if the sugar levels are not being well managed, that they're not within the normal ranges. The best would be to do it before a meal.
Okay.
Yeah, before a meal would be good. But then, if that is not possible, daily would be the other alternative.
Okay.
You do it daily, especially early morning. That will give you what we call the fasting blood sugar.
Yes.
But within 2 to 3 months, there's another test we call glycosylated hemoglobin. HbA1c is more medical. But every 2-3 months, that test helps to see how your body is managing sugars, because this helps us to see how much sugar is attaching itself onto the hemoglobin. Hemoglobin is a carrier of oxygen and carbon dioxide in the body. It lives in the red blood cell. So that glycosylated hemoglobin tells us, then they look at the percentage. Is this shooting above the expected limit or not? So if it's shooting beyond 6%, we think that's abnormal. You're not managing sugar as well. You need re-education. We need to review your medication plans. And then maybe you're not doing exercise. Maybe you're not adherent to your drugs. And so maybe the drugs are not working for you. So all this has to be reviewed. So then that means it's good when you have diabetes, it's good to do those reviews.
Yeah.
The fasting blood sugars, if you're managing within normal ranges and you're not having those symptoms, then you could even be doing it weekly.
Okay.
All these things have costs attached to them. So when we talk like this, we talk the ideal, but also we talk what is practical. What is practical? What can we manage within our setting? So those are important. At times, even the pricking, people dislike the pricking because it hurts a little bit. Luckily, with the sugar, when it sits on nerves, the pain is a little bit reduced, so you'll not be feeling the pain like any other person else. Pain will not be so exaggerated. But the other thing, as we said, is because of the complications, they would need to always inspect, especially if you have people you're living with, they should inspect your feet every time, because sugar, we said, will reduce your sensation, even to pain. And then you hurt yourself without you knowing, you begin to rot without you knowing. So if somebody checks and they can find, hey, you hurt yourself and you're not aware that you hurt yourself, so that can be taken care of early enough. Otherwise, any opening on the skin is an open door for a disease to get into your body. We said everything bacteria loves sugar. And so the moment the sugar, they will pour in numbers and multiply in numbers and cause us harm and probably death. But if we know about this diabetes and we take good care of ourselves, we do our part, changing our diet, doing the exercises, and then being adherent to the medications and monitoring ourselves every 2-3 months, especially the glycosylated hemoglobin tests, then you can be in charge of this disease, as we said. Once you're in charge of this disease, you will live as long as anyone else, and you might die of another condition, not necessarily sugar, because it will be under control. And that's what we wish for everyone who has diabetes. We want them to manage this diabetes and be in charge of it, and for them not to succumb to this.
Yes.
Yeah.
Okay, thank you very much, Doctor. Actually, we can now even immediately pick up from there. You talked about the foot rotting. Let's actually even pick up from there. What are some of these complications in case a viewer outside there fails to manage this diabetes? What are some of those complications these people always get or develop?
Yeah, okay. At times, because of people are busy, they may not be unable to eat routinely, and yet they are adherent to their medications. So the medications can drive the sugars below the normal ranges, which is expected for the body to function. And so they go into what we call hypoglycemia. So I already talked about the symptoms. You begin to tremble, sweat, and so at such a time, if you've carried a piece of sweet, you can take it. Or you can start just a spoon of sugar and drink, because you're going down. Your sugar levels are below the normal ranges in the blood, so you're beginning to be affected. So that's one of the complications, especially for those who are on medication and they're not eating normally. They may easily slip into that. And so the other is excess sugar can cause problems in the brain, what we call diabetic neuropathy, but also you may have problems in your eyes. Sugars sit there and cause blurry vision, and at times you may even become blind because of sugar sitting there. And so they can go ahead and cause complications in your kidneys. They are everywhere in your blood. I said in the blood because bacteria loves them. You'll most often be falling ill because of a lot of bacteria proliferating in your blood. And then I already talked about this diabetic foot. You will have sugar sitting on your nerves. You're not feeling any pain. You hurt yourself. You're not taking care of it, and so a wound begins. And these wounds don't easily heal.
Yeah.
I already said why they don't easily heal. You're not sensing anything, so the body does not even deploy the soldiers that has got to fight these diseases there, because there's no pain there. Sitting on blood, so blood supply down can be challenging. So this eventually complicate the wound. The wound is reinfected with different kinds of microorganisms, and so you go into diabetic foot, and you continue to carry this non-healing wound called diabetic foot or the ulcers. So in that way, those are some of the complications, but some are mostly now for us as a medic, it's really for the community to consume. I think one important was that one where you're adhering to your medication and yet not eating well, you can easily slide down to
hypoglycemia, blood sugars.
And yet if you're also not adhering to your drugs, the sugar levels will shoot well high up. You become confused at times in coma. You're rushed here in the hospital in a coma. So if somebody falls suddenly and there's history of diabetes, please, that one you don't have to take any longer time at home. Just rush to the facility. They will, I'm sure the team on ground will know what to do with you.
Okay.
Yeah.
Okay. All right. By the way, doctor, I happened to take a time and went to the hospital. I found a woman, they said she had a diabetic foot. The foot was rotting. It was smelling like it was even not accommodating people around. And they said they are going to amputate or cut off the leg. That thing was scary. So people have to take note of your guidance.
Yeah. So the amputation is real, and if you go especially in the what we call the surgical ward, and you hear that rotting smell, most likely that is a diabetic foot. And if we trace backwards, probably this patient was not in charge of this diabetes. Got this, it could be a little prick even, and so failed to heal down the road. And so if we do not manage the sugars, we're giving room for those complications to come. Either your brain is hit, or your eyes are hit, or your kidneys are hit, or your foot is hit, okay, or your blood is hit, because those are where the complications can come. And so it's important. As you said, usually when you hear that smell in the ward, even patients who are ill who will wish to be discharged
Yes.
They would wish to be discharged. First of all, it's bad smell for the patient, but even for the patients around. And imagine how it could be for the doctor who is working, the nurse who has to dress this wound every day. So the complications are big. Yes, they are nurses. That's what they're supposed to do. They will do it. Surely they will do it. They won't run away from that. They will do it. But the nearby patients, even this patient, you know, once that, of course, that adds now another complication, stress, which we actually don't talk about.
Yeah.
We don't talk about it because maybe we think it's not physical. Yeah, but people are running away from you literally because you're smelling bad for them. And so those are the complications, because you know, health is defined not on the presence of a disease or physical deformity, but even spiritual and social well-being. And so this person becomes, on top of the bad physical condition, socially is is not good, and so is unhealthy. Even when you're trying to fix health, is not. So if it is destroyed the tissues so much, the best would be to cut it off, which we call amputation. And if we continue not taking good care of it, we keep cutting. So we can cut you through to almost where you now cut no more, because Christ said, if one thing is making you hurt or making you sin, cut it off. So we cut it in an attempt to ensure that we protect the other area so that it heals. But also, if we do not take good care of it, it continues like that, because you can't stay in the hospital forever.
Okay, all right. Thank you very much, Doctor, for that discussion. Hope our dear viewers are getting to note of this, how serious diabetes is. Actually, in case if you don't manage it well, you can develop what doctor called the diabetic foot. And also, if you fail again to manage the diabetic foot, they will amputate or cut it off. So if they start from the lower foot, if you again fail to manage, you may find they reach up to the upper thigh, and also they cut off the whole leg. So it's a guidance for us all and also the viewers to take note of the doctor's advice to keep safe. Even if you have the diabetes, please follow the guidance, the nutrition aspect part of it. Maybe doctors, we are coming to the wrap up of the show. You could talk of this medication aspect part of it. These drugs, are these patients supposed to take these drugs daily? And also we hear some like injections. You can also maybe talk about that as we are coming to the climax of the show.
Okay, thank you so much. I didn't want to bring that so much because medication, doctors tell according to every need of the patient. It's not a general thing for everyone that every diabetic patient gets the same medicine. We tell according to. Once we diagnose with diabetes, we attempt to manage your sugars within with some particular molecules. It could be drugs. Of course, there are various types of drugs, and then it could be the injectables. Also, there are many types of the injectables. And so that's why I say that really for consumption of the community, that we can leave it to the doctors. But yes, we can have injectables, we can have most of the oral, the ones you swallow in form of tablets, are usually once a day. There could be a combination of them, but we will attempt to give you one and then fix you if that works for you. If it doesn't, we try to increase the dosage or add a combination to this and then monitor you. If then it works for you, then we will keep you on such a medication for as long as necessary. But if your problem was because your pancreas is not producing insulin, then most times we go and give you an injectable. Mostly it is that's when we bring the injectables. But if your diabetes is because of responses to the insulin or failing to take that, then that's what we go for, the insulin.
Okay. All right. Thanks very much, Doctor, for giving in your time to educate the public about this chronic disease called diabetes, which affects all ages. Hope our dear viewers have gotten to note it and you saw how serious it is in case you don't manage it, as it can take you to getting these diabetic foods. Maybe Dr. Sam, conclusion remarks as we come to the climax of the show.
Okay. Yeah, thank you so much, Mr. Moderator. Diabetes is real in our communities. It doesn't respect any age group or sex or any social being, whether you're rich or poor, it doesn't respect that. But once you have diabetes, then it is important that we have to seek information so that we know how to take good care of ourselves and also a family member who is maybe diabetic. And so we already talked about all these things. Also put in your program routine reviews. At least if you fail to be reviewed by a DAKTARI at least twice in a year, if you're diabetic, that is important for you, because we said we do some tests which monitors how your body is managing sugars 3 to 6 months prior to such a time, so that in that way, if you need help, that help can come on time. Okay? Yeah. Otherwise, I'm thankful to West Nile TV for giving us privileges to interact with the community and share with them pertinent issues like diabetes. Thank you.
Okay, thank you very much, Doctor, for your time. We appreciate, we know you are always busy, so we can't take your time for granted. We wish you, our dear viewers, the best of your day. Till we meet again next Thursday. Thank you very much. Nice day.